Hello and welcome to the Art of Being Human. I've been dealing with kind of a series here on problems, different kinds of illnesses that affect people's lives, many of them chronic illnesses that will plague them for most of their lives. And I'm doing it because I want to help people who have friends that are ill, who have family members that are ill, so they will understand what the conditions are and what they can do to help them. But also in case you've recently been diagnosed, or in case you've been diagnosed at some point with one of these illnesses, because we all know people that have them. Even though that some of these illnesses are considered to be rare, most of us know people that actually have them. So knowledge is power to a certain degree. We can't change the illness by understanding it, but at least if we have an idea of what we're dealing with, if we can grab a handle and hang on to it, it's going to be easier for us to deal with. And there is help for most of these illnesses anyway, so I want to just give you that kind of hope. Today I want to go into one of the most difficult of them, and it's going to be amyotrophic lateral sclerosis. Now that's a long name, but usually we call it ALS. Can you imagine? I can't think of anything that's much worse other than being in intractable pain that can't be met. But other than that, I can't think of anything worse than being in a body in which the body can't work. The body is useless. You can't talk. You can't express an opinion. You can't take care of yourself. You can't bathe yourself. You can't dress yourself. You can't call somebody on the phone and say, gee, I saw this article in the paper. This is interesting. And you are in a body that is completely paralyzed for all practical purposes. And yet, your organs work all right, and your mind is all right. You can think, you have ideas, you would like to express yourself, and yet you have a body that's incapable of making any kind of sound, a body that's incapable of talking. You can't call anybody, you can't talk to anybody, you can't take care of yourself, you can't do anything. You are completely helpless, and yet your mind is perfectly normal. How bad is that? You know, we used to say, my sister and I have discussed this, people who have Alzheimer's, there's a period of time when they know they've got it, or they know they have dementia. And that time is the most difficult of all because they're suffering from the symptoms. They can't think clearly, they can't talk right, there are things they can't do, and they know mentally they're going down and down and down and down, and they have a realization of that. They're better off psychologically if they don't know. When they get to the point that they don't realize that they are having tremendous dementia, when it doesn't dawn on them, when they're not thinking, when they're not communicating, but they don't know it. They don't have a conscious awareness of how ill they are. It's easier to adjust when you don't know. In a way, that statement, ignorance is bliss, is really true. If I were to have dementia and I got to the point where I didn't recognize I had dementia, and so therefore I didn't know of the things I couldn't do, I would probably be more comfortable than if I'd been given a diagnosis and lo and behold I suddenly realize that my mind is failing. I can't do what I used to do. I can't think the way I used to, and I'm consciously aware of just how disabled I am. That's a terrible thing to put up with. With a disease like ALS, you remain mentally acute, you remain mentally normal all the way through the illness, and yet you become less and less able to respond. I saw on television a man who has ALS, and he was in a wheelchair, and he wasn't so helpless that he couldn't understand what was, of course he would understand what was going on because the nature of the illness is that your mind is normal. But you could tell by the expressions on his face that he would like to communicate. He had an expression on his face where you were aware that he knew everything that was going on. He could make movements with his lips, so you were aware of it, that he knew everything that was happening. Now, as the disease progresses, he won't even be able to do that. So you have a perfectly normal mind, and a perfectly helpless body with no way to communicate or take care of yourself or make any kind of help for yourself in any kind of way. Well, this is a horrible thing. Of all the chronic diseases that I am in the process of discussing, this is one of the worst. Motor neuron diseases. ALS is a part of a group of illnesses called motor neuron diseases, so I'm using it as an example, and then I'm going to go on to motor neuron diseases kind of in a general sense. But let's take a look at this illness. Amyotrophic lateral sclerosis, called Lou Gehrig's disease because Lou Gehrig, who was a famous baseball player, had it. It is a progressive, fatal neuromuscular disease. It will kill a person. There's no known cure, but there's also no cause. Who knows how a disease like this gets started? And the patients are usually men over the age of 60. In the United States, there are over 12,000 people who have it. There are about 3.9 cases per 100,000 people. Now, I've always been curious as to the statistics of this. How can 3.9 people have an illness? 4 people out of 100,000 would make sense, but 3.9 out of 100,000 people doesn't make a lot of sense to me, but that's what the statistics says. It doesn't affect the brain. It does not affect involuntary muscles. In other words, the heart is normal, the lungs are normal, the digestion is normal, but it's those movements that you make on a voluntary basis that become paralyzed and not able to function. So it attacks the voluntary muscles. Now, voluntary muscles are going to be muscles that you walk with, muscles that you talk with, muscles that you move with, muscles that allow me to move my arm around or to get up and walk out or to sit down or to look at somebody and say, oh, how are you today, and wave my hand at them. Voluntary muscles, that's what's affected. But all of the muscles, everything that causes you to be able to live, the way that you can digest, the way that you can think, anything that has to do with the heart, the viscera of the body, perfectly normal. So that means you have a perfectly normal person, and sometimes even a brilliant person, and a body that's useless. It becomes useless over a period of time. And that, I think, is the saddest thing of all. I think one of the worst things that happen to a human being is to have thoughts and feelings and want to communicate and be a social being and have no way to let anybody know how you're feeling, just completely helpless. Okay, so anyway, it attacks the voluntary muscles, such as speech. The speech becomes slurred and becomes slow. One of the first symptoms will be that a person can't talk right. They can't get their words out right. Now, the same is true of myasthenia gravis, which we've already covered, but it's also true of this. So, thoughts, heart, lungs are okay. Speech, voluntary movements all fail, and it gets worse and worse over a period of time. So what I want to do is discuss the motor neuron diseases. There are a group of them. ALS is a part of that group of motor neuron diseases. Now, if you've heard of the man Stephen Hawking, there's a movie that's just come up about him. I think the title is An Answer for Everything or A Reason for Everything, something like that. I don't think I've quite got it right. I haven't seen it, and it's basically about his life. It is PG-13, so there's probably some things in it that children shouldn't see, maybe adults too, but it does talk about his life, and he has a motor neuron disease. A motor neuron disease is the same things that happen to people as happens in ALS. The body becomes helpless, but the mind is clear. Now, he is a very, very brilliant person. He's the Einstein of our day, possibly possibly the most brilliant scientist that's alive today, and he's absolutely helpless. He sits in a wheelchair. His head is kind of crooked over to one side. He has attached to his wheelchair some kind of an arrangement that's like a computer, so that he is able to communicate, but the way he's able to communicate is through the computer. He can't talk. So there's a process he has to go through to be able to do something so that the computer can respond and talk for him. I don't know how complicated this is. I imagine it's quite complicated. I'm not a computer type person. I don't understand a lot about it. We grew up without them. But at any rate, I am fascinated by it. I would like to know how it works. And this movie talks about his life. So he's a brilliant scientist, and he has motor neuron disease. Now, this is a group of rare disorders. ALS happens to be one of them. The nerves that control the muscle movements degenerate in the brain and in the spinal cord. So you have all of the nerves that control your muscle movements, and it's done by the central nervous system. You think about something, I think about moving my hand, I move my hand, and I can do it. But the impulses come from the central nervous system. Something destroys, I don't know if anyone knows what it is, something destroys all of the nerves that control muscle movements. And that you realize you have muscles in your face. You talk because you have muscles around your lips, and everything that you do, your eyes, you have muscles around your eyes. There are muscles everywhere, and they cause the movements that we are able to do. I wouldn't be able to blink my eyes if I didn't have muscles that allowed me to do it. And we do it naturally, and we don't even think about it. It's something that just happens to us. So at any rate, the nerves that control the muscle movements degenerate in the brain and in the spinal cord. The brain and the spinal cord is what composes the central nervous system. You do have ganglia, and these are groups of nerve cells kind of in a clump. They're outside of the nervous system. They're outside of the central nervous system. They exist in parts of the body, but they're not within the spinal column. So they're not a part of the central nervous system. And sometimes they get destroyed as well. This gives a weakness, atrophy, and a wasting away of muscles. You probably don't realize, if you're in a hospital bed, you've just had surgery, how quickly your muscles atrophy. It is very, very fast. It can be measured from day to day. Weakness, more weakness, more weakness, more weakness as the days pass. You atrophy very, very rapidly. You have to keep the muscles moving for them to continue to be normal. Well, the muscles atrophy, and they can't do anything about it. Patients with this kind of a condition can't do anything about it because they can't move their muscles. I don't know how much somebody coming in and doing exercise with them will help them. It will make the muscles be a little bit better. Maybe they won't atrophy as fast, but the person's not going to be able to move their muscles no matter how much you do for them. So it is a problem. There's no known cause for this illness. ALS, or Lou Gehrig's disease, is a part of it. They are one or two cases diagnosed as motor neuron. There's one or two cases in about 100,000 people. It is considered to be a rare disease, but a lot of us know people that have ALS, and that is a type of the motor neuron disease. Patients are usually 50 years old, more common in men than women, and 10% of it runs in families. There is a familial context here. I'm not saying it's really inherited, but there is a familial context. In terms of illnesses that have a family context, you may be more prone to an illness if it's prevalent in your family. It doesn't mean you're going to get it, but it does mean that you're more prone to get it if the circumstances are right. If there's a lot of heart trouble in the family, mine has that problem, it doesn't mean any one particular person is going to get it. But it does mean that you're more prone to it if the circumstances are right. For example, if you're smoking or if you're doing something that's bad in terms of your health, you would be more prone to get it because of the family circumstances. So, a lot of people, they don't know what's in their history. They don't know what their relatives had way back. It's worth knowing because you don't know when you might be struck with an illness. I have a nephew of mine that's just been diagnosed with Parkinson's. And I didn't know there were Parkinson's in the family, but there is Parkinson's in his family. And so if you look back, you can find that some people had that illness. So there's a family kind of thing going on here. So patients over 50 years old tend to get it. There are other motor neuron diseases, progressive bulbar palsy, progressive bulbar palsy, progressive muscular atrophy, where the arms and legs are weak and they twitch. So the ALS symptoms, which is a part of this syndrome, the first you notice is, in terms of the symptoms, you notice that the hands and the arms are getting weak and the muscles are wasting away, and there's an involuntary quivering of the small areas of the muscles. They start to cramp. They start to get stiff. Well, they can't move because the nerves that would cause them to be able to move normally are being destroyed. So therefore, the whole movement, the way that the person moves and the way they express themselves, that's all changed due to the illness. All of the extremities are going to be affected. The extremities are going to be your arms and your legs. There are some of these illnesses in which the symptoms appear on one side of the body and then later on appear on the other side of the body, and eventually all the extremities are affected. So, but it starts off with one side. Now in this case, all of the extremities are affected and the sensation and bladder functions are normal. The weakness progresses to breathing and swallowing, and you can have death in 2 to 4 years. Although the disease can progress from 15 to 20 years, sometimes people die a lot earlier because it's going to start to paralyze the breathing. If it paralyzes the breathing and swallowing, there's a real problem of choking. And this is the thing I think that would be frightening, to be in a wheelchair and to be all alone and have to have somebody with you constantly, because if you're alone, you can't help yourself in any way. What happens if a fire starts in your apartment? You can't get out. It should be a very frightening thing if a person is in a wheelchair and they can't do anything to help themselves, and if an emergency rises, they can't do anything to help themselves. They just are put right where they are, and that's where they stay. Now, in Stephen Hawking's, he moves around. He has a wheelchair that can be moved around. He himself cannot move. He's written books. He's absolutely brilliant. He's written books. He's a physicist. He knows a lot about a lot of things, but he can't express it. But yet, it's considered to be a great honor to be in his presence because of his brilliance and because of the fact that his mind is very clear, very active. The brilliance has not diminished. The bodily function has. He is the perfect picture, if I can say it, of people who have these kinds of illnesses. It really is a terrible thing to work with. You do get nerve degeneration. It cannot be slowed. And the physical therapy, sometimes you can give physical therapy, and in the process of the illness, because it does take some time to get worse and worse, you don't wake up and suddenly you're helpless. It sometimes will help with a person and how they feel, and it sometimes makes them more comfortable. Wheelchairs are used, walkers are used, ventilators can be used with feeding tubes that will help a person. And but you see, they can't really swallow well, so the food has to be given to them through feeding tubes, and because if they swallow, they'll simply choke. The patient in the final stages of the illness cannot speak, cannot swallow, cannot move, but their awareness and their intellect and their mind are perfectly normal. Now, to me, that's the worst of the worst. They have to go through something like that. But with medical help, they can live longer, they can get nutrition in even if they can't eat, even if they can't swallow, they can be hydrated through tubes. It's a miserable way to have to live, but maybe if it can be helped to make them comfortable, maybe it's worth it. People want to live no matter what their situations, and no matter how ill they are. A lot of people just grasp at life. That's perfectly natural, that's perfectly normal. And the idea is to try to make them as comfortable as you possibly can so they can live as much with a good quality life as possible. And as I said, it does take some time for the final stages, 15 to 20 years. It gets worse and worse with time. There is no known cure. But there is help in keeping a person comfortable and to a certain degree keeping them productive. So I'm going to close it here. We're about out of time. And then the next time we will be going into Parkinson's disease. So please join me then.